In this video, I will help you understand whether you should use the standard protocol or EMD to help keep a client contained when you work on the first memories for processing with EMDR therapy. Please join me. I'm Dr. Michael Patterson, clinical psychologist and EMDR Europe accredited senior trainer. I want to help you improve your practice of EMDR therapy. When we face our new clients, we get a good idea where they might be on that continuum of complexity from the well-adjusted to the most complex client presentation at that end. If the client is from here, the well-adjusted, to round about here, about halfway, then I would be happy using the standard protocol with them, by and large. But the more complex the client's presentation is, then the less likely they will be to have resources, have good affect regulation, and more easily be put into the state of hyperarousal or hypoarousal. In other words, going outside the window of tolerance. These are the clients who, when we're working with them, we need to spend a significant amount of time in the preparation phase, creating stabilization for them and also widening the window of tolerance. The thing to remember in terms of this window of tolerance, for clients at this end of this continuum of complexity, the well-adjusted clients, there is a wide window of tolerance. The further down we go, the window of tolerance gets narrower and narrower and narrower until it gets extremely narrow for the most complex client presentation. For these clients, we're spending time in the preparation phase widening that sufficiently so that they can stay with one foot in the present and one foot in the past. Even with that, they may not yet be ready or able to go to the past events. These clients at this end of this continuum of complexity tend to be the ones who have had the experiences of significant neglect and abuse of different sorts. Multiple adverse childhood experiences that have shaped them negatively, and their lives now are about trying to cope and survive. Working with those clients, then I can identify some recent past events or present triggers that we could potentially process. That way it can keep the client contained. Rather than use the standard protocol, because if we do, then that might take them straight away to those past experiences that they're not yet ready or able to approach and process. If we use EMD, that keeps the client contained. A way of thinking about that is like a horse, a racehorse with blinkers on. It's now focused on where it's going, straight down the track. If the blinkers are off, it's seeing things out the side, it gets distracted and it could run in the wrong direction. By using EMD, it's like putting blinkers on the client to keep them contained and prevent them from going down those associative channels. It makes sense when you think of it. What I say to the client then is to think about a particular memory or part of a memory. And this could be a recent experience. Bring up a picture that represents it. We get the negative cognition, the positive cognition, the VOC, the emotion, the SUD. Where do you feel it in your body? So noticing that picture, those negative words, that feeling in your body, just go with that. Just notice. Add in the bilateral stimulation. At the end of a set, have a breath and what do you notice? If the client is still focusing on that particular memory, we can go back thinking about the picture you started with and those negative words. How disturbing is it for you now on the 0 to 10 scale? 0 being neutral or no disturbance. 10 is the worst possible disturbance you could imagine. We continue on doing that with each set until we get a desired shift. The SUD might come down from, say, an 8 to maybe a 2, or 1, or even a 0. If it doesn't go to 0, I'm not getting hung up about that. The reason being, the earlier memories, which are unprocessed, connect to where the information is stored, and they can still feed into the present to reactivate that particular memory and stop it from going down to 0. So remember, if you're working with something which is a recent past event or a present trigger, you haven't yet processed the past events. They can be feeding into it and preventing the SUD from going down to 0. EMD can be used very effectively for the most complex client presentations. I would use it on a regular basis working with more complex clients, but having done significant work in the preparation phase, first of all, remember, keep your client safe. I hope this video has been helpful to you. If it has, please click like down below. Also, if you wish, you could subscribe to the channel. It's free. I want to help you become the best you can possibly be in delivering EMDR therapy. Together, you and I, we can make a big difference in the world. Thanks for watching.